My name is Naomi Cameron. I'm a 10th grade student attending Palisade Preparatory School, it's right down the street. And today I'll be presenting 3 case reports based on ameloblastoma. Sorry. Yes, please. So a little background information. Ameloblastoma is a body of rare odontogenic tumors. That means they form in the mouth, and they usually arise from the ameloblast cells, which are the cells in the mouth that form the enamel. They're very uncommon tumors. Actually, of all oral tumors, only 1% are ameloblastoma. And so it's not common for people to get them. But of the ameloblastomas that do occur, 80% occur in the mandible, which is the lower section of the jaw. One point I didn't make that I should have is that they're characterized by a high recurrence rate and locally aggressive behavior. In most cases, though there is no sex or race that has been determined as developing ameloblastoma most commonly, the age range for ameloblastoma is 30 to 40 years of age. And the 3 types of ameloblastoma that I'll be discussing today are ameloblastoma, malignant ameloblastoma, and ameloblastoma carcinoma. So this is the histology of these 3 different forms of ameloblastoma. And basically what they've done, they took a portion of the tissue and they've examined it. And so for ameloblastoma, there's a lot of order in the cells. I don't know if it's easy for you to see, but in the cells, they're arranged in what they like to call a honeycomb or bubble-like pattern. And so it's a lot of order in the cells, and this is the least aggressive form of ameloblastoma. Here in the second slide, we see malignant ameloblastoma. And the histologies of these 2 tumors look very similar. However, malignant ameloblastoma comes with other characteristics such as invasion at the roots of teeth, metastases to other parts of the body, and it can kind of fool you when you're looking at the histology of these cells because it's common for doctors to sometimes mistake malignant ameloblastoma for ameloblastoma because of the similarities in their histology. The third is ameloblastoma carcinoma, and as you can see, there appears to be almost no order in the cells. The honeycomb or bubble-like pattern is not found in ameloblastoma carcinoma, or AC, as we will be calling it from now on. Further information on distinguishing between the 3 types. Here, metastases, this is when a part of the tumor will sometimes break off and travel through the bloodstream to other parts of the body. The most common site for metastases is the lungs, and so you can imagine it's kind of dangerous because these nodules can affect the activities of very important major organs in the body. So for ameloblastoma, it's uncommon for this to happen. For malignant ameloblastoma, or MA, as I'll be calling it, it's uncommon. The metastases are more common, and for ameloblastoma carcinoma, AC, the metastases are almost a characterizing factor. And so for treatment of all 3 types of ameloblastoma, radical treatment is necessary. And so doctors will perform jaw resection or sometimes a hemimandibulectomy. It's a very long word, it took me a long time to sound it out. And basically, this is when 1/2 of the mandible or maxilla, which is the upper part of the jaw, will be removed in order to remove the whole mass. And so this is a very radical surgery, and it's necessary because of the high recurrence rate of these tumors. If the whole mass is not removed once, cleanly, the chances for recurrence are very high. So here's our first case report, and here this is a case report of ameloblastoma. A 63-year-old woman came in complaining of swelling in the upper right side of her maxilla, and this is the upper part of the jaw, of the mouth rather. And so here's an actual picture from the case. What the doctors chose to do was remove the mass by performing a maxillectomy, in which they removed the teeth as well as the entire mass to ensure that it was fully removed. And here's the histology again, the very organized cells within the tumor were the characterizing factor for diagnosing this. And so the whole mass was removed, And so here's a picture of after the surgery. There was no recurrence, and so that means they removed the mass like they were supposed to. And there were no metastases to other parts of the body. And so you can see the woman is now, I mean, of course, missing teeth, but the whole mass was removed, and she has had no flare-ups of recurrence in 13 years of observation. Next. Our second case report deals with MA. Here, a 24-year-old man came in complaining of swelling. And so the histology here, it says it was benign histology, and it looks very similar to ameloblastoma. However, after performing a hemimandibulectomy, and just to kind of, I guess, divert, you can see that one half of the whole jaw is removed, and it's either replaced with some kind of steel rod, or part of the femur is removed, part of the tibia is removed to help strengthen that area where the whole jaw was removed. And so after performing this radical surgery on what the doctors thought was ameloblastoma, next slide, they realized that the mass had recurred 5 years later. So you'd think after removing his entire jaw, the mass would be gone, but in fact, parts of it must have remained, and recurrence occurred 5 years later. And so he was treated with radiotherapy, but 2 years after that, they found that the mass had metastasized into the lungs. And so we can see the two new nodules in the lungs here and here. And this is the original mass that was formed in his mouth. And so in order to treat the nodules, the doctors decided to move up a step in radiotherapy and treat it with chemotherapy. Next slide. And so after 2 cycles of chemotherapy, the pain in his mouth disappeared, and also the size of the nodules decreased by 30%. If you look, you can see this decrease in size after 2 cycles of chemotherapy. The same decrease was noticed in the mouth as well. And so this progress was maintained after 6 cycles, and the mass was controlled and condensed. Next slide. This is our third and final case report. It deals with ameloblastoma carcinoma, AC. Here, a 27-year-old man was complaining of a painless swelling in his left mandible. And as I stated before, this is the most common place for ameloblastoma to form. He also complained of pin and needle feeling in his lips. And this is because of the intense and aggressive invasion that ameloblastoma is characterized for. Nerves were being pushed aside and moved out of the way as this tumor began to grow and expand in the man's mandible. Clinical examination or initial observation showed that the mass was approximately 5 by 3 centimeters, and they also found a second mass in the front of his mandible. So this is just to show you where the masses were. In the front here, it stretched from teeth 42 to 32 here. I don't know if you can see it very clearly, but notice that the roots of teeth are being moved, teeth are being, pushed up and out of the way as this very aggressive tumor was forming in the man's mouth. Okay, so they decided to treat the man with, radiographic investigation, and also a jaw resection was performed. And this is like the hemimandibulectomy. They removed the jaw and continued to treat him with radiotherapy, not only in his mouth but also in his lymph nodes and other areas of the lungs where ameloblastoma is noted to metastasize. In conclusion, ameloblastoma is a type of tumor. It occurs in the mouth, and even though it's very rare, as it's allowed to progress in one's mouth, it becomes more aggressive in behavior. So chemotherapy, though it was used in one of the cases that I mentioned, it's not a very proven method of treatment, and so many doctors would choose to shy away from it because it's still being tested as a form of treatment, though it was effective in the second case. So surgery remains the most common and trusted method of treatment for any form of ameloblastoma. In order to keep things like metastases and jaw resection away, it's important to detect ameloblastoma early and also to have it removed properly the first time. Thank you.